So with this particular panel, I'll pose the first question and then I'll invite questions from the audience. Unfortunately, we don't have a roving mic, so if you could just please make sure that your voices project. And away we go. So the first question I've got for all of you is, as sexual health peer educators, what are you hearing from young people in terms of what sexual health issues concern them?
This is cool. I suppose a lot of the questions they get at Freedom Centre, I think, are quite general questions that a lot of other young people face. How to protect themselves from STIs and BDDs, how to protect themselves from pregnancy, what's consent, what does that look like, what does a healthy relationship look like. I think those are quite simple questions that exist across all young people. They want to know, but particularly for Freedom Centre, they just want to those questions answered in a very inclusive manner, as opposed to often when we do sexual health, it's in a quite heteronormative manner. I don't know if Kai or Habiba have anything different?
Yeah, so I definitely agree, like you obviously have your sexual health related issues, but then there's the issue of access. And I think we can all agree that access is often something that does come up. But I think something that really stands out is the difference between private and secular education, and how young people are taught different things in different schools. And so, you know, when they come together from all these different schools and they meet in drop-in centres and, you know, wherever they're meeting, some of them feel really left out because they don't have the information that other young people have, especially when it comes to same-sex or LGBTIQ plus information. I feel that, you know, the more religious schools often might hesitate, or the teachers might hesitate to talk about that. So that's a lot of the feedback that we get from the young people that we work with. And I don't know, like, can you guys agree with that? Yeah?
I second that.
Yeah.
For me, even though obviously both of us work for NIA, we both work the same job, I tend to work in some of the really at-risk groups. So most of the time I'm working at drug and alcohol youth centres and working with people who have been through juvenile justice often. And they often have really different priorities and things they want to know than people who are in school and have had that education. Some of the people I work with have not been to school for years and they're only 15. So they've completely missed out on the basics. So sometimes with 19, 20-year-olds, we have to teach them, you know, about their own body and what that looks like and how that works. And most of the young people don't know what a clitoris is. You know, we have to teach them about pleasure, which often gets left out as well. You know, a sex-positive approach isn't always taken in schools because teachers feel uncomfortable with that topic, and so they stick to the puberty and they don't go past that. And I think the benefit of a peer-based project is young people ask us things they will not ask a teacher. I get every weird question you can imagine because they've never had a chance to actually ask that before. And I see Matt, who works with us, nodding, just like, yep, weird questions. But the main thing is that I think we're really good at being non-judgmental. And if it's a question that we think is weird, that we don't need to show that because, you know, we're trying to normalize anything that they want to know. And if a teacher kind of reacts poorly to something, then they're not going to ask again and they're not going to seek that information and try to do things safely.
Oh, just to add on, we had someone ask us whether AIDS was started from gorillas or something like that. Like, it was a crazy question, and we literally just like Googled it on the spot and we're like, this is what Google says, but we'll come back and, you know, give you a more educated response when we know it, because we're peer educators, we're not like experts in our field, but it's just creating that common ground. When we go out to different drop-in centres and places, our first contact with them isn't to teach them sexual health. Our first 2 sessions are just to get to know them, and so that they have familiar faces coming in 2 to 3 times over the next couple months, and they get to know us, and then after that we start giving them the sexual health blood-borne virus information. So I think that's what we do, well, not to just pump our tires, but like it just helps.
Rapport building.
It just helps, yeah, to build rapport pretty much.
Yeah. Do you want to go next?
Questions from the audience?
Oh, okay. Just on that, with drop-in centres and that, where you've got a constant rotation of people coming through. So we have a youth service in my community town, drop-in centre. The difficulty I have is that it's different people every time. So getting that, I would love to do that, you know, get to know you over a couple of sessions and then go into things, but I find it really difficult because it'll be a different group of people each time, really.
And it works really well. Like, we have all these icebreakers that we already have, like a list of icebreakers. We go in, we play all these different games with them, sort of suss out the vibe in the room, and like it just builds up. And then we come back a couple months later and they're like, oh, you're that girl who taught me this, and you know, it works really well. Yeah.
Yeah. I always say, like in the youth, like at Freedom Centre, we have Freedom Centre, for anyone who doesn't know, is essentially a youth centre for LGBTI people under age 26. So we have a similar thing where, you know, one session you have a whole bunch of new people, and the next session's a whole bunch of different people, and you won't have that kind of consecutive people continuing. But often that's a good opportunity, because I'm someone who's there quite often to already have that rapport, to have those conversations with those young people. And there's always value to having people like YEPCRU or SHQ or any other service who does sexual health have to come out and have those chats and have those conversations as well. So yeah, don't let that be a barrier.
We've got a question over here.
What's the most challenging thing that you face?
Interesting open-ended question, Laurel. I just finished my 50% of grade assignment for Laurel in class, actually. The most challenging thing, I would say, is sometimes you work with really difficult people. I actually find sometimes the staff are the most difficult people at centres. They have a lot more conservative attitudes sometimes than the young people. And certainly these had to deal with a lot of stuff on my behalf because I am a queer person. If I'm open about that, sometimes staff have an issue with it. When young people, they want to know, they want to understand. Sometimes it's something that it affects them directly. They're asking because they want to know how I'll react to, you know, someone coming out to me so that they can get a gauge of how other people will act. Or, you know, young people ask things like, sir, what's a cum shot? And, you know, a staff member might be like, no, that's inappropriate, but our job is to teach them no matter what they ask and to make sure that we're answering anything and doing it in a non-judgmental way. So that means not prioritizing certain topics over others just because they might be a little more taboo. And that's sometimes tricky to manage, that we're there to support young people, not always to make the adults happy. And I always prioritize the young people first and making sure that they know what they want to know, as long as it's, you know, relevant to their well-being.
I was just going to say, sometimes copying looks from staff that are there, so I'll be running an activity and like I hear them literally talking about me in the back, and you know, you just have to shut it out at a point in time. Or that they'll be criticizing the activity you're running and you know it's doing good, but they're just upset over kids swearing, and that's not my fault. They already swear. They swear outside of your program. They swear at your program. Like, I can't help that, and I'm just trying to, you know, push a positive message. So that's definitely a barrier. But again, you just have to just push through, I guess. It's a taboo subject already, and so if you're gonna take on what the staff is saying, it's just gonna make it worse for you.
Yeah, I think I agree with that. Also, I suppose, looking at society as well, you've got these young people obviously want to know a lot of information, a lot of access to sexual health stuff, but it's always difficult hearing their experiences or the negative stories and how to kind of, that's always hard to sit with knowing you're trying to help them and then you hear these other stories.
Any other questions? Yes?
Do you adjust the approach that you take or the activities that you run depending on the age that you're working with, and what do you do if you've got a drop-in centre with a really wide range of ages?
Yep, so we've worked with, so a really good example of that is Ignite Basketball, where they have a massive age range. I think it's from like 8 all the way up to 17, so it's pretty big. So we just get like 3 to 4 YEPCRU down, and we'll break them up. So and we'll cater it to be culturally appropriate as well. So we'll break up, I think it's 12 to 17. It'll be males and females, or like whatever's culturally appropriate for that group. And then we'll do the younger kids. So I often get stuck with the younger kids. But no, they're absolutely awesome. And the thing is, it's just trying to make the activities go with the age group and getting them to understand the concepts which are appropriate for them.
They're all the same core concepts, really.
Yeah.
I mean, I think it's important to note that we're not changing what we're teaching them based on their age. It's just the way that we teach it. So like every age group should know about consent. It's just whether it's consent in relation to their current relationships that they're having that are sexual, or with younger 8 and 9-year-olds about like protective behaviors and consent and that kind of stuff. So it's just tailoring it so that we're teaching them the same skills, it's just making it more appropriate to what they're currently doing and living in their lives.
Any other questions?
We don't bite.
I've got a
Unless
question.
you ask.
So, in terms of the work that you've been doing with young people, and this is for all of you, what health promotion messages are appealing to young people? So what do you think are stuff that is working out there in terms of pushing that sex positive harm minimization type messages?
Harm minimization is great. The main thing is, I'm biased, but obviously inclusivity. So those messages need to meet the needs of everyone. So if it's only about straight sex, then lots of people are going, this doesn't matter to me, which was me in high school completely. And you know, making sure that everyone can relate to those messages fully and see themselves represented in promotion and campaigns, so that they feel like, you know, there are people like them that they can ask questions of. And that's definitely the best part of my job, is going out in my rainbow shoes and people going, oh, you're one of us, great. I need to ask you all these things I couldn't ask the teacher. How on earth do I have sex? How do I ask someone out? Like the most basic things you can imagine, but definitely visibility goes a long way.
Yeah, I agree with that. Also, I think when you work with young people, it's just really quick, simple, easy messages. They won't want some convoluted explanation. They just want to know, like, the basics. Like, they're not going to remember an essay if you say an essay. No one's going to remember an essay if you say an essay. They just want really quick, easy to remember sexual health messages. I think are always the best.
I think the Snapchat stuff is really good. I've seen the Could I Have It videos through Snapchat, and it's really, like, I think it reaches out to a lot of people. You can pick the area that it goes out to as well. So I think that works really well. I think you need to reel them in. So Carl had really cool memes. I think I'd fall for something like that. Like, you know, just real young people in, even if it's not directly related to sexual health. You know, you want them to like your Facebook page, and then you start sort of giving them the information through that.
Any other questions? Really? More questions? Yeah.
You mentioned something before, like the pleasure is often missing from a lot of sexual health campaigns and all the messages there, and I'm wondering, it's a double-barreled question, guys, so please hold on to your seats. Wondering, like, whether you've had any questions from the youth around sex toys and pleasure, and how you would want to see that implemented in a sexual health education sphere.
Yeah, I mean, we definitely get questions about, lots of questions about porn. I love doing porn literacy with young people, and doing that with young people who are, you know, 12, 13, because most of them have actually seen porn already. And if we're waiting until they're legal age to watch porn, we're missing out on a lot of people who are getting really negative or not realistic messages about their lives and their bodies based on, you know, if they don't get it from a teacher, then they're going to go and look it up online and they're going to get porn. And, you know, part of that is lots of pornography does have dildos, butt plugs, you know, sex toys in it. And so lots of people are asking, like, what are those? Where do I get them from? How does it work? Is it, you know, can I get an STI from a dildo? Particularly diverse groups, they don't know, you know, how to have safe sex. They just know how to have sex because porn teaches them one and not the other. And yeah, it's tricky to make sure that we're really catering for all of the different things. And the main thing I think with peer education is we're like listening and answering questions sometimes more than doing workshops. Our informal outreach, we often get lots of questions right away because someone goes, I need to ask while you're here, please tell me this. Yeah, so just answering instead of always talking at someone, it's being more collaborative.
I mean, sometimes it's just the really simple questions, like what does sex feel like, you know, and just being able to have a response in that point in time. So it doesn't necessarily have to be like, you know, all sex toys and stuff. It should just be like, what is it and how does it feel? Is it different for everyone? Like I just had a young person who just like all these questions all in one go, and I was like it's very, you know, varied, and just having that response ready, I guess.
I suppose the first step is just acknowledging that sex is pleasurable when you're talking about it, because often that's the one thing that everybody ignores. Yeah.
It's not just for procreation. That's what, not like 90% of the time, it's not that. But I mean, I would say, like, we do have young people who are asking about pregnancy because they want to fall pregnant, or young people who are hoping to have children and they want to know about fertility and that kind of stuff. And that does come up, and we do talk about it because, you know, we should. I've definitely met a lot of young people in the AOD space who part of their recovery is now they can have sex and feel safe and comfortable doing it. And a lot of young people I've met, they want to have children now that they are clean or sober or whatever you might want to call it. And so, you know, we're acknowledging that these things do overlap, like mental health and recovery or alcohol and drug recovery. Sexual health is a big part of that recovery for them. And there needs to be sort of more sexual health education happening in those spaces as well, because it's a part of that, you know, holistic approach with the project. Yes, anyone else?
Probably another 2 questions, if anyone's got any for the crew.
I had a question just going back to our last session about community consultation, community engagement. I work for the Department of Health. We do a lot of campaigns and websites, programs, resources, evaluations, you name it. And we try to sort of get that youth input and youth involvement. So I don't know if you had any tips for, you know, researchers or practitioners or those sorts of people, like who to engage, how to engage, making sure that young people are getting their opinions incorporated.
Social media online is obviously a really, really great one. Going to places that have already got established young people, so like schools, youth centres, anything like that, there's already young people there. You'd be surprised how keen they are to just get involved, particularly if there's something like lollies, chocolate. Like,
Free food.
Yeah. Like, free food is a big pull. Like, it's a big pull. That's what I first go.
I would say it's about valuing young people's time, that they don't want to come and share their really personal stories for nothing. They want their stories to be valued, and that often means, you know, $50 gift card for a Kohl's voucher or something. Always brings people in because they feel like their stories are actually being valued. And they want to actually, often, the problem is that consultation goes somewhere and they never see the end result. So it's really making sure at the end that you social media post or email those people and say, look, this is what came out of all that effort you put in. Because young people are really politically engaged and they're engaged with these issues, and they want to see that come to fruition and see how they actually made an impact. And I mean, one of the great things is YACWA, where I work, we have a whole bunch of advocacy groups of young people. So we have a disability youth advocacy network, we have a LGBTQIA+ one, we have multicultural youth advocacy network as well. So particularly making sure that you include a lot of diverse range of people in those consultation is really important as well. But you have a large portion of networks all around of young people who are really keen to advocate and to be involved with these kind of things. The tricky part is when those are the kind of people that are already in a really good place with this stuff or are familiar with it, are the ones that come to consultation. So trying to make sure that you reach out to the people who also aren't generally engaged with those issues are really important too, and trying to find a way to incentivize people that feel like their opinions don't matter to make sure they know that they do.
Oh, I was just going to say, sorry, just having it in a local place, like taking into consideration school hours. I know often, like when I'd want to do things that'd be during school, so that made it really hard, or like transport, you know, trying to get mum or dad to drop me off, or, you know, like just the little things, take them into consideration because they mean a lot to young people.
And in terms, just adding to that, in terms of engaging young people from at-risk or disadvantaged backgrounds, there are often gatekeepers of those communities, and they often sit on youth network meetings or youth networking events or committees. So attending those committees, knowing who the gatekeepers are of those communities, then you'll get a really good idea of what the demographics are, what the needs are, and then from there you'll be able to access those young people in those communities.
I'm going to be annoying and add more to that as well. I think you probably agree with this, that when you say the word gatekeepers, I instantly think of LGBTQIA+ people that, you know, when it comes to people in power, people doing consultation, they're often service providers, and a lot of people in our community have had really negative experiences with services that aren't inclusive, and so they won't engage with a consultation unless it's really explicit that they're included and that they'll be safe there and they'll be respected. Because the assumption is that unless it's explicitly stated, then you're just not included at all. So you'll notice a lot of the services here are really great, and they've got like rainbow flags on their posters and whatnot, because you have to be that explicit still in the world we live in to make sure people know they're welcome and that they can be involved in that consultation and have their voices heard. Questions?
We might wrap up, but do you guys have a final thought or a piece of advice or anything to these wonderful audience, engaged individuals?
Yeah, you go first.
I probably I'm going to cheat off of Carl. He did a really great presentation on listening to what the young people want and what they need, and understanding that we come from a place as people who work with young people, that we have asked for, we might believe we're doing the right thing and that kind of thing, but also it's important that we take note of what the young people we work for and with are saying and what they want and what they need. I think that's the absolute most important thing, and then doing everything we can to address those concerns.
Yeah, I think I got mine right. So, actually I got it off you. So you said we work for the young people, so make sure that you, I guess, are doing your job and are reaching out to the young people and really taking them into consideration. I think sometimes we get so caught up in the actual like sexual health blood-borne virus kind of stuff and forget all the little things. So yeah, like young people have some really awesome experiences that you can learn off, so just make sure you tap into that.
I guess the main thing I can think of is just young people are all individuals still, and sometimes we forget that and think all youth have this attitude or they want this kind of education, and it's hard to sometimes step back and go, actually I need to ask this individual young person, what do you want to know and what can I do to help, or what questions do you want to ask, so that we're not just giving this one ubiquitous answer to everything. Because yeah, young people are all different and they all have something that they want to gain out of coming to a session or coming to a center, and making sure that you're providing, hopefully, whatever each individual young person needs and wants out of your service. So making sure you actually ask that question. And I mean, if I'd been a young person and asked that, that would have been amazing, but often we forget to ask.
All right, well I think we'll thank you to the youth panel.